Hey all, it's been a while since I've made a YouTube video, and I don't know why I felt called to do one now. Um, but I recently got shockwave therapy. I had a back injury 2 years ago, lifting, and I thought I had torn something. They thought it was a strain, or they think it's a strain, and I'd been living with pain for almost 2 years straight, and I went to physical therapy. It was getting better, and then it would just go right back to like this like knot about the size of like a pea, if you will, on my left rhomboid. And then I got a trigger injection shot after like MRIs and all that stuff. They weren't seeing anything. I got a trigger injection shot, the first only one, and it got probably about 80% better. So that's when they thought, or they said it was a potential muscle issue, because before they thought it was a nerve issue. And then the pain was unbearable the first 4 or 5 days. That's what they didn't tell me. When you get a trigger injection shot, I guess if you hit the right spot, it aches, like it's sore. It's like a 20-minute procedure. It's literally like kind of like a mini surgery. They did the dry needling, and then I think they did the cortisoid, or whatever it's called, the steroid shot. Um, then I re-injured it on stage, and I decided once and for all, trusting my gut, that I was going to get shockwave treatment. So I got shockwave treatment. The first session was kind of painful, not really. It feels like something's just like in your skin, just like pumping up and down. And then I was really sore for about 4 to 5 days. I think she did a little bit too much on the scale. It was kind of like you go in, they put lube on this machine, and then they spread it around an impacted area, and it just felt like this weird push, like a pulse. And then she was going up and down the rhomboid, and then I asked her to go up a little further, and it was like a trigger, something, I guess it was a trigger point right here, and I felt it down below in the rhomboid, so I thought that was really interesting. Afterwards, I was super sore for about 4 to 5 days. Started to get a little better, and then I went back for another session. I'm doing 4 of these. The second session, she toned it down a little bit using the wand, but I did notice probably about 2 days ago, I noticed that the pain had subsided. Not all the way. I'm probably now at about like 92%. Like, I just can't even believe I've been walking around with that much pain. And I noticed something. It's helped me have a really good relationship with my body the last 2 years, in terms of just paying attention to the little aches and all of that stuff. I noticed that when I was sitting on my bed, I turned. This was like right before I left for Palm Springs, like a few days ago, just to get away. And it felt like it felt on the inside like a little something was just coming undone. It was hard to explain, but again, I've become so in tune with my body. I just really listened to it. I was like, oh, I think something happened back there, to where just something got the adhesion, which is what they said it was, and the muscle knot just started to slowly break apart. Today I feel great. I'm able to bend. I'm still resting my back, clearly, just kind of relaxing. Um, and then I'm going for my third session tomorrow. I will keep you all updated, especially for those that are interested in shockwave therapy, or those that don't know anything about it. Um, I think it is something worth pursuing. I will definitely keep you updated on my progress. Hopefully within the next, I think they said after like 3 months, I should know if it really worked. But right now, dude, it's been phenomenal. So that's my little shockwave therapy story. And for anybody that lifts or athletes, I used to be heavy into sports growing up as a kid, teen, and then started to do pickup stuff as an adult. but regularly went to the gym. Anybody that's lifting and whatnot and has experienced some type of tear or chronic pain like myself that's not going away, I highly recommend looking into shockwave treatment for now. I will keep you posted. All right, bye.